Welcome back to 12 to Health. I'm Dr. Derek De Silva. For people with diseases such as MS or Parkinson's, their conditions often prevent them from getting proper exercise. Lack of circulation can become a big problem. Fortunately, there's an FDA-approved treatment that can basically do the exercise for them. It's called whole body periodic acceleration. And here to tell us about it is John Gallucci, physical therapist and president of JAG Physical Therapy in West Orange and Warren. Thank you for joining us.
Thank you so much for having me.
So what are some of the problems associated with people that have poor circulation?
Well, poor circulation becomes deconditioning. Deconditioning, of course, becomes other circulatory issues such as not being able to breathe properly, not having good oxygen go through to basically nurture and nutrition the musculoskeletal system. And basically what happens is the person becomes deconditioned and has the effects of deconditioning on their body.
What conditions, what disease states, and when we talked about Parkinson's, we talked about multiple sclerosis, why those two and what other conditions predispose us to
Well, the
this?
unique thing about the XRS bed, which is the product that we're talking about, is that the acceleration therapy increases the circulation in the body. When you increase the circulation in the body, you have nitric oxide that's released. When you have nitric oxide released, basically what happens is you're now oxygenating the muscles, you're basically opening up, decreasing inflammatory processes, you're getting nerve endings to fire quicker, and basically a person with, let's say, MS who has spasticity will basically decrease the spasticity after they get a treatment on the bed.
Right.
And most people that have MS are not able to exercise because when you exercise, it exhausts the muscle and exacerbates the symptoms.
Right.
Yeah.
And then, you know, but I just still want to come back to what other conditions? Multiple sclerosis, Parkinson's, diabetes, heart disease?
We see people with diabetes, cardiovascular issues, of course, people that have high blood pressure, people that are suffering from different things such as arteriosclerosis and other problems. Lung issues. You know, the whole concept is to increase the circulation of the body. So any pathology that can benefit from exercise, but the patient cannot exercise, this bed basically gives them the opportunity to get those benefits of exercise.
And how much movement, how much exercise, and we hear 15 minutes, we hear 30 minutes, how much movement, how much exercise is necessary for people each day?
Well, the normal person should be, I mean, that has no pathology, should be exercising anywhere between 30 to 45 minutes a day, cardiovascularly 6 days a week. That's what most of our regulations and nutritionists and exercise physiologists, physical therapists, athletic trainers, they're all pushing that direction. You need to do 30 to 45 minutes of cardiovascular exercise a day. Now you take somebody with a pathology, they can't give you that time.
Right. So tell us a little bit about this whole body periodic acceleration. What is it? And we also have some video that we can show and you can comment on that. But what is it?
So basically it's a bed that oscillates. And the bed has a setting on the bed, as you can see in the picture here. And the patient, based on the pathology, will lay down on the bed. They get strapped in on their feet and the oscillation goes back and forth. Usually it's about 140 oscillations per minute. The bed only moves about 16 millimeters each direction, and usually they're on there for about a 30 to 45 minute treatment themselves.
Right.
The unique thing about it is when you step off of the bed, you have less aches and pains, you feel invigorated, and if you are a patient that has these pathologies that are achy and stiff, and as I said, when an MS patient with spasticity, you get off the bed and you feel like $1,000,000. So we've had MS patients that walk up with a walker, get on the bed for 35, 40 minutes, come off the bed.
And how long does it last?
Some patients have described it that they could go a whole day. Some patients have described it for 2 days. The manufacturer of the bed and the inventor of the bed are very big on people purchasing the bed and trying to use it once a day for 45 minutes.
Now, I said in the introduction that this is FDA approved, so I would imagine that this needs to be prescribed by a physician?
It doesn't need to be prescribed by a physician at this point unless you're going to a therapy session and there's therapy included. I think to purchase the bed outright, it is not a prescription needed.
And
it's my understanding.
Okay. And it's, you know, I remember many moons ago, probably 20 years ago, there was something that you strapped your feet to and you laid on the floor and it just kind of moved your feet, and I think those are still available. Is this the same concept as that?
It's the concept.
Taken to the next level?
It's the concept including the whole body. The whole concept, I mean, let's face it, we all like to have a massage. What's a massage do? It increases the circulation. There's many different types of getting massages, from machines to people. Everybody has a different theory on increasing circulation. The machine machine you're talking about, as you said, 20 years ago, came out. The biggest thing was to push for people that had diabetes, to increase the circulation so there were less effects to the distal aspect of the body. Basically, they then brought the technology into something, and I don't want to use terms, but a plate that would vibrate, and that was the whole body. What Dr. Sackner did was took that technology, took the concept of deconditioning, and basically brought it to the next level for people with pathology.
This was essentially the next level.
And this is what it came out to.
Thank you very much for joining us. Pleasure to have you here.
Thank you for having me.
After the break, I'll answer your health questions, but first, here's a look at this week's Community Health Calendar.